No diabetes is the same. So if you see in a large number of patients, everybody is different, and we called that diabetes is a heterogeneous disorder, and therefore we have to individualize the patient treatment according to the need, according to the presence of comorbidities, the age, duration of diabetes, his weight, etc. So, for example, I'll just give you two extremes example. If you have a young person, age of 40 years, diabetes diagnosed very very in the recent past, and who has got a high blood glucose, then you can afford to treat him very aggressively from the beginning itself, because he has robust beta cells and his response to any type of treatment will be very good. And by using even minimum dose of drugs, you can actually bring down his HbA1c to normal, and you can afford to target an HbA1c of 6.5 because he does not have any comorbidity. The risk of hypoglycemia will be very, very minimal. So therefore, you have a young patient with very short duration of diabetes without comorbidity. You can be very aggressive and you can bring down the HbA1c to 6.5. So you target the tightest control of diabetes for one simple reason, that he has to live with diabetes for a long period of time. A younger patient getting diabetes has a longer exposure time for the risk of complications. On the other hand, on the other extreme, you have an 80-year-old person who got diabetes for the last 15 years, has come to you, and you see that he has got a low eGFR. He has already developed early part of chronic kidney disease. He has cataract, and you also find that he has an ischemic heart disease, which is silent. And when you took an ECG, you found he already had a myocardial infarction, which is a silent myocardial infarction, about 3 to 4 months ago. And the patient has got severe neuropathy, not able to walk. In that patient, you definitely do not target an HbA1c of 6.5. You target an HbA1c of 7 to 7.5, and you try to use drugs or medicines or agents which will have the lowest risk of hypoglycemia, because you don't want him to experience hypoglycemia or have a fall. Very important is fall, which is not usually given enough importance. So therefore, individualization of approach to patient is the key for success of treatment of diabetes.